Good morning, panel members, ladies and gentlemen. My name is Frank Chen. I'm from City University of Hong Kong, representing the team on the project Delivering 21st Century Healthcare in Hong Kong, building a quality and efficiency-driven system under the theme Enhancing Hong Kong's strategic position as a regional and international business center. The project just completed last year. Besides the universities, research institutions, we also partnered with several non-academic organizations which deliver healthcare services. The team is composed of researchers from multiple disciplinaries, from management science, data science, public health, operations management, and industrial and system engineering. CityU is hosted this project with major collaboration with CUHK's public health. As you can see, almost all the local universities, we have collaborators in the team. We also have quite a number of overseas institutions. Here's the major talking points in my presentation. Realizing the diversity of the audience, I would like to quickly go through a few key background items. Then I will highlight a number of academic achievements and their social impacts. And last, I will talk about how to move forward after the project has been completed. Perhaps to provide a background for the project, I use the concept of population pyramids to illustrate the urgent needs. Here in this corner is Hong Kong's population distributions. The vertical refers to the age groups. The horizontal to the percentage of each age groups divided by male and female. Look at the upper right corner, India, which has a young population. Its population pyramid shaped just like a pyramids. At the opposite the corner, Japan, which has aged population, the shape just upside down. Hong Kong is aging rapidly, just catching up Japan in 10 years, 15 years time. Hong Kong's health system is facing tremendous challenges. Not an exaggeration to say that the system will soon collapse if we fail to quickly address them, mainly due to the aging population. A fundamental issue here is the lack of coordination or integration between primary and hospital services, long-term and community care, and between our public and private sectors. One evidence is that over 50% of the hospital admission in the public hospitals are avoidable if we had a better primary care and community care. In conclusion, the current system is overloaded, overly loaded, and not sustainable. The objective of this project is to help develop a quality and efficiency-driven healthcare delivery system that is built upon data analytics and compatible to the internet age, with the theme, better care at affordable cost. Our focus, as we move on to the later stage, the second phase of the project, our emphasis was on the coordinated or integrated elderly care. The project covers 5 major sets of tasks, of course, not limited to them. I will illustrate them next. The overarching framework for the research project is the coordinated or integrated approach to healthcare deliveries. That is, to coordinate primary public health with medical care, as well as social and community care. Our tools are derived upon analytics, data science, and information technology. Emergency department in public hospitals are constantly overcrowded, especially in the flu seasons. Predicting the arrival of patients and managing patients' flows are essential to hospital management and care. Besides academic publications, we also did a pilot, just an example, at a large public hospital in Hong Kong, in which we implemented a machine learning tool to identify high-risk elderly patients at their admission, and then plan for their post-discharge care plan, care services. Here, the risk refers to rehospitalization rates after discharging from the hospital within 28, 30 to 1 year cure. Task 2. The hospital is a very complex system with connected or networked resources, which demand systems and analytical approaches. There are many grand challenges. We helped a private and public hospital, basically 2 hospitals, in their design stage for the patient flows and operations planning, etc. Some of the projects were undertaken by master and undergraduate students project, through which we trained dozens of students. Of course, the hospitals benefited tremendously. Task 3. Although public hospitals in Hong Kong overcrowded, overloaded, and taking up about 90% of inpatients, the private sector in Hong Kong is relatively large as well. So sometimes they have underutilized capacities, and also private sector provides a lion's share of primary care. How to utilize the underutilized capacities and advanced technologies in the private sector remains to be a challenge. In this project, some papers are published, some are still under review. Our team member also recently helped district health centers, decision makers to develop tools for them to design public-private partnership schemes so that private general practitioners, basically primary care doctors in the community, to better serve community elderlies in the districts. Resource pooling and sharing among hospitals, especially let's say in Hong Kong, hospital authority context is important, and also an important topic in healthcare management research. In a consultancy project we completed last year, we helped Hong Kong Hospitals Authority to review its current patient transport systems and also help them to plan the next 10 years non-emergency ambulatory transport services. Task 5 provides tools for carrying out other tasks, and itself is kind of a driving force for academic contributions. We publish a large number of papers in this under this task. The tools can be of a generic purpose for healthcare research and applications. They are long-lasting and self-sustaining. Besides advances in analytics shown in the previous tasks, we also publish in mainstream medical and healthcare specialty journals. For example, our team members publish in certain specialized mainstream medical journals, such as recent one in Gut. I highlight just two. In a recent forthcoming paper in this specialty journal, our team members, of course, collaborated with domain experts from other institutions, as City University doesn't have a medical school, although we have a vet school. Recently, we had established a vet school a few years ago. So in this, this paper is about a treatment of COVID-19 patient using certain instruments, the outcome of the utilization of those instruments, and medications. So, so this is the one. The next one is, in this paper, we developed advanced machine learning tools for predicting future high-cost patients with COPD, which COPD is one of the major diseases, chronic diseases in Hong Kong and in China, perhaps in this region. Okay. We also developed in a pilot stage projects using smart devices and apps for elderly care in the communities. Just illustrate using two examples by our core investigator team led by Professor Kwok Tsui. Okay. And this one, this is developing a personalized telehealth monitoring system in Hong Kong. Okay. Another project that is a general framework for monitoring and health management for elderly, again, developed locally in Hong Kong. Talking about the social impacts. Towards the last phase of this project, we realized, of course, I mentioned earlier, the focus later on, we basically will focus on elderly care in Hong Kong. We realized we have to develop new elderly care models, such as home-based service models using latest technologies, such as the coordinated elderly care and a community nurse in neighborhoods, such this kind of a business model. Yeah. Hong Kong must focus its resources on coordinating elderly care between medical care and community care. Moving forwards, our Hong Kong government has decided to set up district healthcare center in all 18 districts with a focus on elderly residents. This is a very major fields for us to carry, to move forward with the research outcomes from this project. In applying our developed AI algorithm to Hong Kong-wide electronic healthcare records, we are positioned to help districts to identify high-risk residents in the community, and then focusing on, deliver our services accordingly. Those tools can be further developed and used to inform service planning for DHCs. In fact, our members have already been engaged in such efforts. In later 2018, our team member, Professor Iki Yao, led research reports for our Hong Kong Foundation. This is a very important policy reports. It is actually some of the key points we implemented in the government policy already. Okay. Moving forward, okay, recently, or started 2 months ago, we started a project called Home Age, Hong Kong Home-Based Aging for Transformative Community Care, funded by Bank of Hong Kong, China, Hong Kong. It's about 24 million Hong Kong dollars for 3-year project. We are going to carry on some of the findings from this project for community-based elderly care. Utilizing the tools developed from this project to continue to extend to the community care, elderly care. Using smarter devices as well. And we also the team members got funded by the government policy funding schemes. In particular, one strategic policy funded the project focusing on elderly, community elderly care using artificial intelligence tools to support the district healthcare model in Hong Kong. For the sake of time, I think I have to end it here. If you have further questions, I will be happy to answer them in the following Q&A session. Thank you very much.
Hi, my name is Yiman. I'm going to be the moderator of today's sessions with Professor Chen. Two questions already came in. First is from Ken. His question was, are your findings translatable to mainland and elsewhere? Professor Chen?
Okay, I would say yes, for the tools developed, like the analytical tools, yes, developed in this project can be generic. Of course, some of them are very Hong Kong specific, like machine tools, but the general tools developed in general can be applied universally in China as well. But for the policy oriented, Hong Kong's healthcare system is very much different from mainland, for example, elsewhere. So maybe even can supplement.
I think a lot of the algorithm that is developed are data-driven. I think that certainly is an approach from which both the machines and the researcher can learn from the specific context of which the healthcare system is built. And I think that's what makes Professor Chen's and his team's work so special, is that context-specific approach to data analytics and operation research. The next question is from Yu-Wing Qin. The question was, why would you highlight District Health Center in your presentation, and how would the project related to the DHC?
Okay, technically, there's underserved population, okay? So those health centers, okay, I'm not criticizing anything. I'm just an observation with a complement to this model, because we feel, the centers, health centers are for the relatively healthy elderly, citizens, residents. Our project, is actually, I would like to see this project. We are emphasizing those in between. Acute elderly, you have to go to the hospital, institutionalized elderly, and between the really healthy, relatively healthy patients. All right. Anyway, so this is our project, is new focus. I mean, of course, the project already finished, completed. We are talking about this new project, the new projects we are embarking on now.
The question is whether the extent to which, when you highlighted DHC, what's the relevance of why did you pick DHC as one of the applications of the findings of your research?
Another one is the tools developed here can be applied because we needed to identify elderly who need the care the most.
I think one of the key things is the District Health Center is Hong Kong's attempt to implement the concepts of community-oriented primary care, different from general clinic-based primary care where you go into doctor's office and get help. The starting point of community-oriented primary care is actually to diagnose the community and then proactively targeted those who need help and reach out to those who are hidden from the general population, the fabrics of different social institutions, and provide support and primary care support. So there are different targets of these prevention efforts, primary, secondary, tertiary. Long story short is that that's great, very fruitful, and actually the only possibilities for these types of activities through these big data analytics approach. So we, Professor Chen, and work with the different operators in the DXCs and try to implement a different AI that's again suit the context of which the carriers deliver, so to enhance the project. Hope I have answered your questions. There are two more questions as asked. One is from anonymous attendees who start asking how big data and machine learning can be achieved in this area. I think that's how the applications of these big data and machine learnings in healthcare. So I think that Professor Chi Ping might be a good person to answer these questions if he is in the audience.
Thank you very much for the question. So this is a huge advantage of the TRS project, because TRS serves as a platform to gather the experts in data science, in healthcare, and others. So through this project, we get access to the data from one major hospital. So we did some machine learning and AI research using the data from the QEH hospital. And based on those evidence and our new publications, we got further support from the hospital authority with 10 years territory-wide data of all the 44 public hospitals. So thanks to the very good EHR system maintained in Hong Kong, we got access to hundreds of thousands patients' data for a decade. So that's really a blessing for our research. And in terms of the implementation, we also work with hospital authority and a few other hospitals and trying to implement some of our risk assessment models into the practice. This is on the way. And also we collaborate, we try to extend the results to some of the hospitals in mainland China. And actually some of our results also involved the data from both Hong Kong and mainland China, so that such multi-center big data study have more validity and also clinical value. I hope I answered your question. Thank you.
Because of time, so I'm gonna have the last word. I'm gonna ask Professor Chen a question that I was dying to know. The big news this week, of course, is the approval and availability of vaccines to aid our fight against COVID-19. I think the general public has never been so immensely appreciative of how clinical, biomedical, and public health science affect our lives. But the relevance of management science in combating the pandemic wasn't clear to me until I read your articles. Actually, it's in the South China Morning Post on cold chain of vaccines. Basically, it's the complex logistics of transporting different types of vaccines, something that I previously taken granted for. Professor Chen, could you share with us your views on the significance of management science and how researchers in management science can contribute to this changed world that we are in today?
Actually, we sent a letter to the South China Morning Post last month about this time. So the vaccination in Hong Kong is a huge challenge, logistic challenge as well, mostly logistic challenge now. So we have successfully conducting a mass testing a few months ago. Now the real challenge is how to get people vaccine. So, okay, I just give you a few examples. This is the cold chains. So there's tremendous logistics and operations challenges here. And as for example, okay, how many? What is a clinic? What are kind of clinics we can administrate the vaccines? Okay. Just a few examples. One example: how do you keep all the records of the people, because it's now all the two shots, right? You have to make sure those people coming back within the short time window are coming back for the same vaccine, right? So and also how do you deliver the vaccines from the central to all the clinics, whether the clinics is the government clinics or the private clinic, including like CTU. We also have a clinic. How to organize those all the the organizing all the distribution logistic issue as a tremendous challenge to us. It's really there's no lesson from history to learn from. So we are ready to help as operations and logistics supply chain and healthcare operations research as well. But this is just. And for the sake of time, the letter I list dozens question issues there to answer, but we needed to get prepared. It's now vaccine ready. The challenge is the logistics and operations. Thank you.